The data that led to the FDA approval of the combination of bendamustine, rituximab, and polatuzumab vedotin come from the trial that was known internally at Genentech as GO29365. Not a very catchy name. This was a trial evaluating the use of bendamustine and rituximab with or without polatuzumab vedotin. The study actually had multiple arms, but the ones that I'll focus on for this conversation is the arm that studied its use in diffuse large B-cell lymphoma, relapsed-refractory transplant-ineligible patients. There was both a phase 1b expansion as well as phase 2 randomized data that came out of this trial. The data from the phase 2 randomized component, which randomized 80 patients, 40 on each arm, to either receive BR alone or BR in combination with polatuzumab vedotin, demonstrated significant improvement in the important endpoints for the inclusion of polatuzumab in such patients. Here we had an improved overall survival as well as complete response rate, progression-free survival endpoints. This was the first randomized trial to demonstrate an overall survival benefit for any therapeutic approach in relapsed-refractory large cell lymphoma in the rituximab era. And that's an important observation and an important study for this very reason. What we saw is that there was significant improvement in survival for the pola-BR treated patients compared to BR alone, with overall survival approximately a year versus approximately 4 months for the BR patients alone. PFS was similarly about 12 months for the treated patients versus about 4 months for the BR control arm. There was a subset of patients who received the pola-BR-based therapy who enjoyed significantly prolonged duration of response and duration of remission, with 20% of treated patients actually remaining in remission longer than 2 years, something that we do not typically see happen for patients with relapsed-refractory large cell lymphoma who are ineligible for stem cell transplant. How durable this response is and how accurate an estimate that is of the durability will hopefully become clearer as the data continue to mature and as we gain real-world experience with this regimen.